Hello, my name is Christy Ferguson, and I am a registered nurse. I have put together a teaching plan to teach imaginary progressive muscle relaxation to older adults, to be used as a tool to reduce anxiety and stress. Progressive muscle relaxation is an accepted nursing intervention. It is defined as facilitating the tensing and releasing of successive muscle groups while attending to the resulting differences in sensation. This process can be real or imagined. Research has proven that imaginary muscle relaxation is an ideal intervention to reduce stress and anxiety. The population that I have chosen to teach this intervention to is the elderly. Chronic anxiety disorders are very common among the elderly. Non-pharmacological anxiety-reducing interventions are ideal for the elderly population because they do not contribute to polypharmacy or increase fall risk. Teaching imaginary progressive muscle relaxation as a non-pharmacological anxiety-reducing intervention to the elderly population is safer, because many of the elderly have physical limitations that may keep them from actually participating in a muscle tensing sequence activity. The nurse's educator has to take into consideration the specific and unique learning needs of older adults when formulating a teaching plan. It is very important to conduct a thorough and comprehensive nursing assessment to determine the learning needs of each individual, and not to make any assumptions. Patient number 1 is 77 years old and goes to the gym 5 days a week. Patient number 2 is 67 years old and has had both knees and a hip replaced. Patient number 3 is also 67 years old and is severely handicapped after suffering a stroke at the young age of 58. All three of these older adults have different learning needs. However, all three also reported reduced anxiety and stress levels after learning the simple imaginary progressive muscle relaxation routine that I am about to teach. Teaching objective. Following this approximately 2-minute guided imaginary progressive muscle relaxation routine, the older adult will verbalize the 10 parts of the body covered in the routine and discuss the imagined movement of each part with 80% accuracy. And now, the presentation. Hello, my name is Christy Ferguson and I'm a registered nurse. I will be guiding you through a simple 10-step imaginary progressive muscle relaxation routine. This routine should be used as a tool to reduce anxiety and stress. Find a comfortable resting position and close your eyes. Imagine that you are doing or feeling the following. We are going to start with your head. Imagine that someone is massaging your head. Round and round. Imagine fingers massaging your temples. So relaxing. Moving on to your neck. Imagine that you are stretching your neck from side to side, from right to left. Imagine your head is touching your shoulders, getting a really good stretch, right to left. Now imagine your chin touching your chest, stretching the back of your neck. Hold it there for a few seconds. Now, imagine that someone is massaging your shoulders, exactly how you like it, relieving the tension in your shoulders. So relaxing. Getting a shoulder massage. Now we go to our arms. Imagine getting down on all fours and doing a push-up. Feel the weight of your upper body falling onto your arms. Down and up, back down and up. Really feel those arms working. Moving on to the fingers. Imagine spreading your fingers out really wide, really stretching your fingers. Imagine making a tight fist. Really squeeze. Spread the fingers out again. Make a fist again and squeeze. Now imagine stretching your back. Imagine bending over at the waist and touching your toes. Imagine stretching as far as you can, pulling on your toes. Now imagine standing up, raising your arms over your head and leaning back as far as you can, feeling those back muscles stretch. Next, your waist. Imagine bending at the waist from side to side, left to right, left to right, stretching your waist. Moving on to the legs. Imagine that you are sitting on the floor with your legs stretched straight out in front of you. Now imagine leaning over and grabbing your toes, feeling the backs of your legs stretch really nice. Imagine you're touching your chin to your knees. Wow, what a stretch. Now, the knees. Imagine pulling your knees in and hugging them to your chest tightly. Really squeeze your knees into your chest. Imagine standing and then bending at the knees into a crouching position. Stand back up and then crouch. Stand back up. And finally, the toes. Imagine standing on the tips of your toes, stretching all the way up like you're reaching for something on the top of a shelf. Really stretching your toes. The end. And that concludes the simple 10-step progressive muscle relaxation sequence demonstration. Do you feel relaxed? How is your anxiety level? Remember, this was just a demonstration. Imaginary progressive muscle relaxation can be done at home, while listening to your favorite music, anytime, anywhere. Feel free to modify this simple routine as you wish to imagine being massaged or stretching your favorite muscles just right. Thank you. Teaching evaluation. After participating in the simple 10-step guided progressive muscle relaxation sequence, the older adult will verbalize the 10 parts of the body covered in the routine and discuss the imagined movement of each part with 80% accuracy. The older adult will be provided with a handout with the 10 items listed and illustrations shown in the presentation. Evaluation will continue with a one-on-one discussion including how the intervention will be used in the future, modifications the older adult may make to personalize the activity, and finally a self-evaluation on if their anxiety level was reduced.